Now, if you've been a nurse at the bedside for a while, you may be wondering, is this all there is for me? It's been a hot second since I left the bedside. It's been about 12 years ago, but I remember distinctly coming to a point in my career where I felt like there's got to be more than this, and I can't continue in this way, and it's not healthy for me anymore. I can't be here anymore. And so you may have come to that point. This is my story as to why I left the bedside. Hello, thank you so much for joining me. I'm Dr. Lisa Chappell. I am a Doctor of Nursing Practice, an associate professor, and studying to be a board-certified health and wellness nurse. I make videos for nurses, nursing students, and caregivers on how to become more empowered and resilient. There are several reasons why I decided to leave the bedside. And don't get me wrong, I want to start off by saying I treasure that time so deeply that I had at the bedside. It really set the foundation for the nurse that I've become and really for the person that I have become. I use my experience with the bedside every single day in my career today as a professor of nursing, as an entrepreneur of nursing. And without that foundational experience, I would not be able to be where I am today. And so I value that experience so much. One of the first reasons I left bedside nursing is because I was tired. I was exhausted. I started off working 8-hour evening shifts. And that meant that I would arrive at around 2:30 p.m. to get report, and I would work until about 11 o'clock at night, especially when I first started and I didn't really have time management down. I would end up sometimes being there until midnight, 1 o'clock in the morning, and sometimes even 2 o'clock in the morning. Then it was really difficult for me to unwind when I got home and then to prepare to come back the next evening. I was so tired all the time. Another reason I was so tired is because I didn't get 2 days off in a row except for every 2 weeks. That became really tiring to continue in that routine all the time. I felt pretty consumed by my work schedule, and this was before I had a child or anything else much going on. And I got pretty tired pretty quickly. And so that's definitely a reason that I left. Nurses generally have to work weekends and holidays. And in order to work every other weekend, it made it so I only got 2 days off in a row once every 2 weeks. Now, I thought for sure that I could solve this problem by doing what I saw other nurses doing, which is working 12-hour shifts. And so I fought hard and I waited it out until I could get a 12-hour day shift. And that was a shift where I would work from 6 a.m. until 6:30 p.m. And that's including a half an hour for report. And then I only had to do that for 4 days. So then my work schedule became a little bit more manageable because I had some days off. However, I felt like I was spending those days off recovering for my next 12-hour shifts, and especially if I would have to work 2 to 3 12-hour shifts in a row. So I was tired all the time. And that is one of the main reasons why I decided to leave bedside nursing. Another reason I decided to leave bedside nursing is because I was anxious all of the time. In being a bedside nurse, you realize pretty quickly the enormous amount of responsibility that you have, where people's lives are in your hands. Your mistakes could hurt people. And even sometimes your mistakes could result in loss of life. That's an enormous amount of responsibility that would weigh on me, to the point I was anxious all of the time. Prior to work, my stomach would hurt. I felt like I was going to throw up. I felt horrible. After a while, you start to learn to rely on a team, and that makes you feel a little bit better. But that feeling, that sense of responsibility and the anxiety that it causes never really leaves you. For me, anyhow, it really took a toll. And so I had to begin thinking about some other ways to get through anxiety. And for me, that meant I needed to get away from bedside nursing. Now, my clinical experience was on a unit that primarily specialized in spinal cord injured patients, and it was a more acute unit where sometimes patients were just weeks after a catastrophic injury. There were ventilators, I was doing a lot of IV management, I was doing gastric tubes management, tube feedings, total parenteral nutrition at times, and patients were relatively stable enough to be in rehab, but there was still that instability after just being freshly injured. Although we were trying to get patients up and into rehabilitation, it was high acuity unit, which sometimes mimicked more of an intensive care unit setting. And so it was definitely at times very high adrenaline and intense management of the medical situation that people were experiencing. Not only were we managing the medical side, but we were also managing the emotional and mental aspect of coming through a catastrophic injury. And this was at times devastating, and it took a major toll on having to watch people suffer in that manner. And that was another reason where I thought to myself, I can't be seeing trauma after trauma, because it was taking a toll on me, and it was ending up affecting me to the point where I had troubles functioning in my own life. The pain management aspect was also very difficult. I battled internally with managing pain, but then also pushing opioid medications intravenously to a point where sometimes I felt it was a little bit dangerous. I care about managing the pain, but then I was also at war with, sometimes it seemed like people just needed to escape their injury, which is understandable, but it's not a long-term solution then to be on constant pain medications. And so I had some ethical battles within myself. Not only was I anxious all of the time, but I was also sad all of the time. I became pretty depressed when I was working bedside nursing, to the point where I thought, I'm not sure I'm cut out to do this. I'm not sure I'm made for this. Maybe I picked the wrong profession even. It really became wearing to watch people suffering over and over and over again. That was tough on me, and so I needed a change. Another reason I left is because I felt like I was not working to the full scope of what I could do and what I was capable of. I was bogged down by other task-related things where I couldn't apply what I had learned in school in really holistically caring for a person, because I was so busy managing other things. I couldn't do the level of education, rehabilitation, empowerment that I really wanted to do. And this is a challenge that a lot of nurses run into very quickly, because you have the scope of practice, you have the level of knowledge and education, and you'll find very quickly that you're not really maximizing it. Another reason why I left bedside nursing is because I was pretty disenfranchised overall with the healthcare system. It was discouraging to learn that medical errors are up there in the top 5 causes of death in the United States of America. Entering into the healthcare system, you have a 1 in 10 chance of having a medical error occur. And being a part of that as a nurse is discouraging. And that was another reason why I decided to leave bedside nursing. We're human, and we're likely to make mistakes, especially if you're tired, you're anxious, and you're sad and depressed. That makes you even more likely to make an error. I wanted to help the problem, not to make it worse. And I felt like staying at the bedside for me was going to make it worse. I would love to hear your thoughts about how you can manage anxiety, and exhaustion while continuing to stay in a capacity clinically caring for patients. How have you managed that? What have you been able to do? What has worked for you in order to balance your life as a practitioner at the bedside and your life outside of that capacity? I would love to hear about it. Please comment below. My solution, my way out, was education. And so right away, when I started feeling these things and I knew that I couldn't stay at the bedside forever, rather than changing professions, I decided to go back and get my master's degree. Luckily, as a nurse, you can do that while getting some tuition assistance. There's lots and lots of programs that can help you through, and then also being able to work. I did find some balance in my life by eventually going to part-time, and that seemed like the perfect balance where I could still do what I loved in helping people and caring for people, but then I could also work a little bit on other things I needed to accomplish. Luckily, financially, I was able to do that. And so you have to weigh and think about what's going to work and what's not going to work as you plan for the future. I also probably could have changed units that I worked on, and that might have given me a different perspective, but I ended up spending all of my career at the bedside on this one particular unit and stayed there the whole time. I changed shifts 4 times in order to survive those 6 years at the bedside. I find that there is a lot of support within nursing and within healthcare that if you want to elevate and you want to work on some other things that you may be able to start while you're at the bedside, there is a push because we know that bedside nurses burn out pretty quickly, that in order to keep them at the bedside, there's programs called clinical ladder programs where you can do some continuing education and you can stay at the bedside but be financially rewarded for it. For example, getting certified, you might get a differential for that, for getting certified in a particular specialty. You may also see a benefit from joining committees, getting on a practice council, a part of making some decisions for change at the unit level or at the organizational level. And these are ways that you can really help to improve the work environment to make it better for you. I did a little bit of that while I was at the bedside, but I wish I had done more because maybe it would have kept me there a little bit longer where I could stay in that capacity at the bedside as a nurse, caring for patients clinically, but be able to still manage my own anxiety and exhaustion or transform it into something positive. And I do realize now that there's other things that I could have done which would have helped maybe to keep me at the bedside. What I did is once I was within a year of graduating with my master's degree, there was a position that opened up at the hospital for a leadership/education position. And this position opened up and I decided to apply before I had graduated with my master's because they said if you get your master's within a year that you could work in this position. This all required, because then I was in a salary position, that I had to move away from my position at the bedside. I think I was open to staying at the bedside, but it wouldn't work out where I could be in a salary position and an hourly position at the same time. I became the magnet program director. I did education using simulation, and I was also a new graduate residency coordinator. Once I got into that role, and even after finishing my master's, I still didn't quite feel prepared to do what I needed to do. So again, I went back to school because I thought it would help me be able to do then the next phase of what I needed to do. And that's led me into education at a university where I teach nursing students, and it's led me to a place where I can even teach in a master's program or even at a doctorate level, should I decide to do that in the future. It's also opened up opportunities for me to become an entrepreneur within nursing, which is what I'm most excited about because I've always had this passion, this desire to help nurses. And that's what this channel is all about. I am here because I want to help nurses who are going through what I went through to realize they're not alone and they have this incredible toolkit to draw upon in order to become more empowered and resilient in their career, and also to become leaders in the future of healthcare. And that's what I am all about on this channel. Thank you so much for watching. Stay tuned where I talk about skills that are transferable that I learned from being a bedside nurse. I'll see you in the next video.